Good afternoon, everyone. Today is about more than information. It is about awakening something inside of you, a deeper awareness that your health, your peace, and your healing matter. It is about empowering you on your wellness journey. That means we want to remind you about the importance, the significance, the necessity of focusing on self care. Prioritizing you is not selfish, it is a necessity. Quick question. How many of you are sick and tired of being sick and tired? How many of us have normalized exhaustion, anxiety, poor sleep, digestive issues, or constant tension as just life? We wake up tired, we push through the day tired, we go to bed tired. And somewhere along the way, survival started to look like normal. We started calling survival a lifestyle. Many of us have carried a generational traumas, pain, hurts, postpartum depression, infidelity, miscarriages, abuse in many forms, and much more all our lives. We just did what our mothers, grandmothers, and great grandmothers did before us. We were told, deal with it. Or, like I heard some say, my dear, we just cry all night. Then we get up, we dry our tears, and we face another day. But have we actually ever dealt with it? Today, I want to speak to the part of you that knows this cannot be what life was meant to be. I want to speak to that part of you that is weary, stretched, thin, and maybe even a little discouraged. Because the truth is, this your body has been speaking to you, and it is time to listen. My name is Candia Cumberbatch Lucenius. I have been a registered nurse for over 50 years, and I have seen many cases of people suffering with many chronic illnesses, no end in sight. They're taking from 2 up to 15 medications, experiencing multiple side effects, and they considered it normal. Some even carry it like a badge of honor. I take 5 different pills for my high blood pressure and 3 for my diabetes. Let me reassure you, it is nothing to be proud of, and certainly not something you should have to live with. It is not normal. Just to clarify, I am not a medical doctor, but as a holistic natural health and healing practitioner, a certified health minister, a certified holistic nutrition practitioner, and a certified spiritual guide, my goal is to educate people on how the body can heal itself, utilizing natural approaches to managing the chronic conditions, understanding the mind-body connection, and the role of stress in healing, as well as what we can do to get our bodies in a state of complete rest and relaxation to help heal themselves. That means you prioritize you. You take care of you. You be your own best health advocate. We educate and empower you to do just that. I would like to introduce you to Holistic Natural Health and Healing, which focuses on the body as it was created by the divine to heal itself. And it requires 3 things. First, a trust in God, as He is the ultimate healer. Second, patience, because sickness didn't happen overnight, and so it will take time to heal. And 3, consistency. We cannot try just one time, taking whatever we take, a drink, a tea, a pill, and we throw our hands up and say, oh, well, I tried. Holistic natural health and healing requires a whole person approach. It is rooted in the understanding that we are not just physical bodies. We are created mind, body, and spirit, designed by God to heal itself. And when one area is out of balance, the rest of the body feels it. Holistic health goes beyond treating symptoms. It is about caring for the whole person, creating balance through natural methods, nutrition, movement, some form of exercise, rest, hydration, emotional wellness, mindfulness, adequate sleep, herbal remedies, and spiritual alignment to achieve maximum results. That means we are not just asking what is wrong. We are also asking what is happening in the whole life of the person. What does the nutrition look like? Are they sleeping enough? Moving enough? Not necessarily just exercise, but movement. Are they utilizing natural remedies? I cannot stress it enough. Treatment, whether from conventional medicine or holistic natural health care, is not a one size fits all, nor is it a substitute for your primary care physician, but rather in addition to. What worked for Maggie Muggins may not work in the same way for you. You must consult a healthcare practitioner about managing your care. Do not use natural health as a reason to ditch everything your doctor has told you. I encourage you to discuss your care with him or her. Allow them to run the tests, whatever diagnostic tests, x-rays, CAT scans, etc. that will help you them diagnose the root of the problem. So what does maximum results look like? We have to start with the mind, understanding how did I get here and what can I do to get better. Our aha moment is when we get the answer to how did I get here? When we recognize that stress, overwhelm, and lifestyle patterns are contributing factors to most, if not all, illnesses. So we explore stress regulation and nervous system balance. The goal is to empower, not to blame. Your body may not be betraying you. It may be responding to the burden that it has been carrying. Stress is not just emotional. It is biological, physical, spiritual, and behavioral. When overwhelm becomes chronic, the body can shift from balance into survival mode, creating conditions where illness may thrive. Many of us have been told, you're stronger than that. Don't let it get to you. Get over it and keep moving. At some point, we have started to believe that, and we've started functioning in survival mode without realizing the toll it takes on our bodies. Many chronic symptoms are not random. They are often signals that from the body that prolonged stress, emotional overwhelm, nervous system dysregulation, and unsustainable lifestyle patterns may be contributing to our physical illness. Some of those symptoms include fatigue, brain fog, weight changes, digestive issues, anxiety, hormonal imbalance, and the big one, frequent illnesses. Sounds familiar? Stress that is not processed becomes stress that is stored. We start to feel the weight of it. The root cause awareness is clearer at this point. We become acutely aware that some of our lifestyle patterns could be overcommitting, people pleasing. We say yes to everything and everyone. B, poor boundaries, people pleasing again, not being assertive enough, oversharing of our personal information. We have a difficulty saying no, taking on others' emotions, and allowing others to disrespect or violate your time and space. C, sleep deprivation, going to sleep late, waking up too early, just trying to complete the many tasks that we have agreed to. D, nutrient depletion. We are too busy to eat. We are skipping meals. E, ignoring our emotional pain. Not processing pain from a relationship, a breakup, trauma, abuse, grief, a spiritual depletion, or a disconnect from our purpose. Once this is clear, we have to get out of that survival mode, constantly running on empty. We have to learn how to live in a way that supports healing, not constantly borrowing from our future health. The turning point comes when the body tells you enough is enough. I know what that looks like. 2 years ago, I had a stroke, totally in denial. Yes, I was overworked, overwhelmed, and stressed, but I teach people how to recognize signs and symptoms of stroke, how to prevent a stroke. I am not supposed to be having a stroke, but that was my body saying enough is enough. It only really hit me when I saw the CAT scan and the MRI report and the doctors looking at me saying, "Ma'am, you had a stroke." Well, I learned to pay attention to my own body, to stop when my body says it needs rest. I learned to set boundaries, to say, "Sorry, I can't," when I knew I needed a break. I learned to take a nap, to move gently, not rushed. I changed my eating habits. I practiced what I preached. And I also made sure I was consistent with my meditation, prayer, solitude, spending time in the presence of God. Because now I do not just teach this message, I live it. My true healing did not come with the blood pressure pills the medical team prescribed. They also told me I was pre-diabetic, by the way. And no, I did not take these pills either. True healing requires regulation, restoration, and reconnection. So we need a whole body fix, a complete lifestyle reset. That's what I needed to do. So that includes rest and nutrition, better sleep, switching to whole foods, proper hydration, and movement, some kind of exercise for the body. And we stop introducing harmful pharmaceutical drugs into our system. Yeah. My lifestyle reset began with a garlic regimen, turmeric and black pepper, cinnamon, guava leaves. Emotional wellness. For many, that includes counseling, re-education, coaching, journaling helps a lot of people. Setting boundaries, absolutely. Rest and relaxation for the mind and the body. And yes, that means me too. I had to remind myself to follow the education and coaching that I teach. I couldn't continue on the path of do as I say and not as I do. So our spiritual alignment, reflection, take time away from it all, whatever that means, whatever that looks like for you. No weekend getaway. I love those. I do that with my women's group at least once or twice a year. It could be a day at the beach. It could take a day, a week, or even a month to find your purpose, to find your, what am I missing? What am I supposed to be doing? Did I answer my calling? Faith practices, something we call practicing the presence of God through prayer, meditation, and reflections. Exercise, big one. There's so much healing in movement. I personally love to dance. What's your go-to exercise? For some, it's the gym. Me, not so much. But I'm getting there, working on it. Healing begins when we stop treating symptoms like interruptions and start listening to them as invitations. When we listen to our bodies. That is not a punishment. It is an invitation to choose differently, to reset, an invitation to honor your body, an invitation to protect your peace, to make changes, an invitation to live in a way that supports healing instead of blocking it. The final truth is you cannot heal in the same patterns that helped make you sick. That's why you make the changes. You prioritize you and you set those boundaries. Your healing journey starts today. Remind yourself that you are not powerless. You are not too far gone. And you are definitely not meant to live in survival mode forever. You deserve rest. You deserve peace. You deserve care. You deserve healing. So today I invite you to begin again. Not with fear, but with a sound mind. Not with shame, but with resolve. With wisdom, with intention, with courage. And with the belief that your wellness journey is still unfolding. You have more power than you think. Your body is designed to heal itself when you support it. That is what we are here to help you do, to empower you on your wellness journey.